As the country battles the rising number of COVID-19 cases, this week hospitals are also gearing up for the usual New Year trauma cases. So to get a sense of how provinces are readying for this pressured time, joining us now, the KwaZulu Natal Head of Department of Health, Dr. Sandile Tshabalala. Good afternoon to you and thank you very much indeed. One report that I'm reading today says both private and public hospitals in KwaZulu Natal are filled to capacity. Paramedics are complaining that they are struggling to get patients admitted. What's the picture?
Good afternoon to yourself and good afternoon to the viewers of the program. We can report, Jeremy, that we definitely are inundated with a lot of patients that deserve to be admitted for different reasons. The reasons could be COVID-19 reasons, but also non-COVID-19 reasons, including the trauma patients. And that is making a life very, very difficult for our healthcare workers. However, we're trying to reopen some of the beds that we had closed down because the first wave went down and we closed down on some of the private, in particular, beds that we had started. So we are reopening them to ensure that at least COVID-19 patients are admitted. Also, the minister has assisted us in giving us a rapid test, which will help us to find out quicker whether people are coronavirus positive or not, and we then admit them into the correct wards or release them if we need to. So there are means and ways we're trying to deal with, but the workload is increasing and our staff is trying to do the best they can.
There are reports that say that many patients in the province are being transferred, particularly out of Durban, to other provinces. Is that true?
There is a plan. Remember, when we set our resurgence plan, we set a resurgence plan on top of which we set a festive plan. Among the important factors in these plans is that in the province of KwaZulu Natal, we're going to have people being admitted in their hospitals, which are their catchment hospitals, and we're going to work with the private sector as well. But if needs be, people will be moved from their catchment institutions to other catchments within the district, but also if we need to move them out of the district, move them to the districts other than their own district. You are correct when you're saying eThekwini. eThekwini is registering more patients with COVID-19 than other districts. As such, we then find ourselves looking for beds in other districts and moving patients into those districts. So we are working on such a plan. It is in our plan in any case, and we think it is assisting us.
Are you able to tell us what that movement is like, the kind of volumes of patients that you're moving about from hospital to hospital within different districts?
Currently, I have asked that such statistics be collected for ourselves because it was collected as and when it was happening, but we've realized it increasing. And as such, we then have said to the management within the department, can this be collected? So at the moment, I can't give you figures. I do know that as we speak, in one of the districts, we are moving patients from one hospital to another hospital, and probably we'll be moving about 76 patients in that hospital only. Now, you can imagine in other hospitals as well. But to be exact on the number, I would be guessing it, so I don't think I should do that. We are trying to get that statistic at the moment.
I certainly don't want you to guess. This is a very serious situation, Doctor. The other issue, which is of growing concern, is that hospitals in the province, again, particularly in the eThekwini area, are running out of oxygen. What is the position?
No, the oxygen challenge, we did have a situation where, again, I cannot remember the month exactly, the minister made us start to work with AFROX to ensure that there is oxygen in almost all our institutions. And that work has always been ongoing, and we are increasing the oxygen points all over. There are instances where we find that the oxygen level or the pressure is low, and we then resort to using the cylinders. So we do have that challenge because of the demand of oxygen, but oxygen cylinders do assist us. I can assure you that in 2 of the districts, there are 2 hospitals, 1 in each district, where we've already sent people to go and check why is it that we're having low pressure of oxygen, because we want to ensure that it's there, it's available everywhere. So we have that challenge, but we're also dealing with it as much as we can.
Dr. Tshabalala, it sounds like a very difficult situation that you're coping with at the moment, in many ways almost on a knife edge. At some point, are you going to reach a point in the province where all of this is going to collapse, do you think?
Look, the challenges that we're having are that the numbers are increasing. It's not only COVID-19 numbers that are increasing, but also trauma cases are increasing. On top of that, you get a trauma patient who is COVID positive. And that is a challenge that we are faced with. We also will have situations where our staff gets to be infected themselves, or they get to be exhausted in one way or another. That poses a lot of challenge and strain on us. However, we have been allowed to contract some of the nurses to come and work in some of the places. So we're thinking, yes, the workload is increasing, but we are trying to also increase the capacity in terms of the beds available, in terms of the skill available, but also in terms of the general worker numbers. We are trying to improve. We are hoping we're not going to find ourselves being crippled or even collapsing because of such numbers. We, however, are saying, if government has done so much work in making sure that we are ready for COVID-19, where is the community in terms of partnering with the government? Because another thing that we are doing is to do what we call a risk communication and community engagement. Why is that risk communication and community engagement not yielding such that our people are wearing masks all the time, wherever they are keeping the social distance and are staying at home? But besides that, where you go to restaurants and where people take alcohol, you realize the level of irresponsibility that comes with it. So that partnership with the government of the people of our country, I think is going to make life much, much better for the health industry, but not only the health, the general population of KwaZulu-Natal and the country.
Let's just hope that people heed that warning. Very quickly, Dr. Tshabalala, I know that you're very, very busy. Would you be in support of a stronger lockdown?
A stronger lockdown would make sense, but we are cautious of the fact that in the initial lockdowns that we've seen, we also saw a high number of gender-based violence and other violences that are associated with people being bored at home or being really frustrated at home. As well, we've seen people losing jobs in the process. So we will put that on the hands of our leadership to say what measures can be put so that the workload on the healthcare workers is fine, but the non-pharmaceutical interventions also are implemented correctly without the country suffering. That is important as well.
Thank you very much for joining us. I do appreciate the very honest assessment. That is Dr. Sandile Tshabalala, who is the KwaZulu-Natal Head of Department of Health.